Welcome back, ladies and gentlemen. Less than 2 months ago, there were just around 30 cases of black fungus infection recorded in India. But in the past 2 weeks, the rare disease has been reported in large numbers across the nation. So much so that 4 states have declared it as an epidemic too. Even the centre is maintaining a watchful eye, while Rajasthan, Haryana, Telangana and some other states have classified this as an epidemic. Earlier in the day, it shot off a letter as far as the centre is concerned to states asking them to make mucormycosis in any shape or form a notified disease, which means every confirmed or suspected case will have to be reported to the centre. This potentially fatal disease has posed another challenge to India's already strained medical infrastructure. Hospitals across the nation are worried because, unfortunately, it is the treatment that causes mucormycosis in most states, making doctors warn against any unadvised self-medication. But as the cases across the nation mount, we ask if it is time for a new treatment protocol. And that is going to be the question we are going to be asking our expert joining us this evening. And with me tonight is Dr. Aparna Mukherjee, Senior Scientist of the ICMR. And Dr. Aparna Mukherjee, we're seeing increasing cases of mucormycosis, or what is popularly called black fungus, being reported in various states. The high dose or overuse of steroids has been seen as one of the reasons. It has been stated as one. Is there a standard protocol that is now required in terms of prescribing steroids for tackling COVID-19, because that seems to be the cause for creating black fungus in many cases?
Yes, as you rightly said, black fungus, which is a nomenclature that we are hearing now, but then it's basically mucor. It's from the mucorales group that we are getting. So mucormycosis is basically an opportunistic infection. That is, whenever there is a compromise in our immune system, and commonly in diabetics or in organ transplants, we used to get this mucormycosis. Now with COVID per se is causing an immune dysregulation in the body. Then we are having steroids. Many of them are diabetic, and steroid itself can cause a imbalance in their glycemic control, leading to hyperglycemia. That is also contributing to this fact. Then we have high ferritin, which is a known risk factor for mucormycosis, which is also happening in these COVID patients. So as far as steroid use is concerned, we do have protocols or guidances for clinical management, which states when the steroid needs to be used. That is only in the moderate or the severe patients after the first week of therapy. That is when the inflammatory phase has set in. So using it too early in the hope that it is going to prevent any progression to severity is not going to help. In fact, it is harmful in this way that we are seeing that we're getting an immunosuppressed state where these kinds of opportunistic infections are coming up. And also the virus itself, might multiply more if you actually suppress the immune system too much, too early. So it's very important that we stick to this, that we use steroid only when the patient goes into a moderate phase. That is when there is a drop in the saturation, oxygen is being required, and that is actually life-saving. So,
but Dr. Mukherjee, the question that I'm asking you is, the question I want to ask you is that while what you are saying is right and it is known to many people, the fact is that shouldn't ICMR be giving these guidelines as to what should be the load in your RT-PCR test beyond which only, the medicines or steroids should be used to prevent black fungus or mucormycosis? We are not looking at a standard practice across the country. And when it is at the discretion of a doctor itself, patients are in no situation to tell them what to do, what not to do when they're suffering from COVID-19. So how do we tackle the overuse of steroids at this point?
I get your question, but there is no relation with an RT-PCR score or a CT score. RT-PCR score is something different, so there's nothing to do with that CT value in the RT-PCR. It's not called RT-PCR score; it's basically the CT value. So that has got nothing to do with whether you use steroid or not. It is your oxygen saturation, which is a good indicator of whether the inflammatory state has set in or not. And for that, we do have clinical guidance managements, which is put up on the ICMR website, on the Ministry of Health website. Each state have taken out their own guidelines, and that specifically states that steroid is not to be given in the mild early phases. It is not to be self-prescribed. It is not to be given in doses other than what it is mentioned, and not for long duration. So these have been again and again being said. So it is like up to us to follow it.
Well, at the moment, yes, it is becoming a bigger issue. As we are coming out of the second wave in many states, the fact is the medicines at the moment extremely scarce. The government has ordered some more companies to come in and increase the production domestically, as well as some vials of this medicines that are required to tackle black fungus from being imported from abroad. We do hope this new dangerous epidemic is controlled before we see more lives being lost. Thank you very much, Dr. Mukherjee, for joining me on the News Hour. Good night, ladies and gentlemen. I'll be back tomorrow on the News Hour at night.